Have you ever felt that quiet pressure around your waist, a heaviness you cannot see, but you sense deep inside? Beneath the surface, there could be a type of fat quietly wrapping itself around your organs, silently increasing your risks for heart strain, blood sugar troubles, and a lifetime of chronic health battles. In this video, you will discover a simple research-backed method that can begin to dissolve that hidden belly fat in just 2 weeks. You will learn exactly what to eat, how to move your body, and which daily habits shift the balance back in favor of your health. By the end, you will know why those trendy quick fix diets fail and how a smart, realistic approach can make you stronger, slimmer, and safer without starving yourself or spending hours at the gym. You will hear lesser known truths about fat that medical experts seldom mention. You will learn why not all fat behaves the same. You will understand the silent danger of deep abdominal fat, the kind that does not jiggle but tightens around your vital organs. You will learn the science behind why certain exercises work better than others, and why some foods quietly undermine your efforts even when they taste harmless. You will also learn the surprising role of stress and sleep, two everyday factors that most people overlook, and how adjusting them can drastically influence fat loss. By watching until the end, you will gain a clear step-by-step plan that fits into an ordinary daily routine. You will see how combining simple training moves with smart eating and healthy rest can yield real change fast. You will learn not through hype, but through facts and proven results. And most importantly, you will understand how sustainable change is far more powerful than a short-lived transformation. Welcome to our channel, where we cut through the noise and focus on honest, effective health advice. If you are ready to take control of your body, to quiet the hidden dangers lurking beneath your skin, and to feel lighter, healthier, and more alive, subscribe now and join our community. Your body is ready for a reset. Let us begin. Visceral fat is not the soft, pinchable fat that sits just under your skin. It is the deep, stubborn fat that wraps itself around your vital organs, hidden away in your abdomen. Unlike subcutaneous fat, which can be seen and felt, visceral fat operates quietly, building up silently over time. It is a type of fat that your body stores not as a cushion you can pinch, but as a hidden layer that surrounds organs like your liver, pancreas, and intestines. Because it lies so close to these organs, it has a direct impact on how your body functions, influencing hormone regulation, inflammation, and metabolism. Too much visceral fat is dangerous in ways that are not immediately obvious. It actively interferes with your body's normal metabolic processes. High levels of visceral fat are strongly linked to insulin resistance, making it harder for your body to regulate blood sugar. Over time, this can increase the risk of type 2 diabetes. It also releases harmful chemicals that can trigger inflammation, which in turn raises the risk of cardiovascular problems, including high blood pressure, heart disease, and stroke. The effects extend even further, contributing to liver issues, hormone imbalances, and an increased likelihood of developing metabolic syndrome. Unlike superficial fat, visceral fat is metabolically active, which means it is constantly interacting with your organs and bloodstream, silently affecting your health. Many people are surprised to learn that visceral fat can be present even if their body looks lean on the outside. You might have a flat stomach and still carry dangerous levels of deep abdominal fat around your organs. This hidden fat often goes unnoticed because it does not change your outward appearance immediately. Regular measurements like waist circumference and body composition assessments are more revealing than the scale alone. Lifestyle factors such as diet, sedentary behavior, poor sleep, and chronic stress all contribute to the accumulation of visceral fat, meaning it can build up in anyone, regardless of body type. This hidden danger is why understanding and addressing visceral fat is so important, even for those who appear healthy. There is a common belief that you can target fat loss in specific areas of your body, especially the belly, by doing exercises that focus on that region. Many people spend hours performing sit-ups, crunches, or other abdominal workouts, thinking that these moves will burn the stubborn fat hiding around their organs. The reality is very different. The human body does not allow for spot reduction of fat. Fat loss is a systemic process, meaning your body draws energy from fat stores throughout your entire body, not just from the area you are exercising. You might strengthen the muscles in your abdomen with targeted exercises, but that alone will not make the deep visceral fat disappear. Even the most intense sit-up sessions or endless abdominal circuits will not directly reduce the fat clinging to your organs. What happens instead is that the muscles become stronger and more defined, but the overlying fat remains largely untouched unless there is an overall reduction in body fat. This is why so many people feel frustrated after weeks or months of abdominal workouts without seeing the dramatic results they expected. Fat in other areas of the body may shrink first, leaving the belly looking the same for a while, which often leads to misconceptions about the effectiveness of spot-focused exercises. True and lasting reduction of visceral fat depends on a combination of factors. Adjusting your diet to include nutrient-rich, minimally processed foods while reducing added sugars and refined carbohydrates plays a critical role. Incorporating regular exercise, particularly a mix of cardiovascular activity and resistance training, stimulates fat burning throughout the body and helps maintain muscle mass. Lifestyle habits, such as getting sufficient sleep, managing stress, and avoiding prolonged periods of inactivity, are equally important. These changes signal your body to start using stored fat for energy, including the deep fat around your organs. Sustainable results are achieved only when these elements are consistently applied together over time, creating a healthier environment for your body to gradually release the hidden fat that cannot be targeted through shortcuts or isolated exercises alone. The most effective way to tackle visceral fat is not through a single trick or a quick fix, but through a combination of exercise, nutrition, and lifestyle adjustments that work together to create measurable change. High-intensity workouts, coupled with strength training, are among the most powerful tools for reducing deep abdominal fat. Exercises that push your heart rate up while engaging multiple muscle groups, stimulate your metabolism, and increase the number of calories your body burns even after the workout is over. Strength-focused training, such as lifting weights or performing resistance exercises, helps preserve and build muscle, which in turn accelerates fat loss. Even just 30 minutes of activity most days of the week can make a significant difference, especially when it is consistent. Staying active throughout the day, not just during designated workouts, also encourages your body to utilize stored fat more efficiently. Nutrition plays an equally important role. A diet high in protein and fiber helps regulate appetite, maintain muscle mass, and support overall metabolism. Protein-rich foods such as lean meats, eggs, legumes, and dairy not only keep you full but also stimulate muscle repair and growth, which is essential when paired with strength training. Fiber found in vegetables, fruits, and whole grains slows digestion and helps control blood sugar, reducing the likelihood of fat storage. On the other hand, sugary drinks, added sugars, highly processed foods, refined carbohydrates, and trans fats contribute to visceral fat accumulation and interfere with your body's ability to burn fat efficiently. Cutting back on these items and replacing them with whole, nutrient-dense foods can accelerate results and support overall health. Lifestyle habits are the final piece of the puzzle. Chronic stress triggers the release of cortisol, a hormone that encourages fat storage around the abdomen. Poor sleep also disrupts hormonal balance, increasing hunger and fat accumulation. Prioritizing sufficient rest, stress management techniques, and daily movement helps create an internal environment that promotes fat loss. Research consistently shows that combining exercise, balanced nutrition, and healthy lifestyle habits produces the most significant reduction in visceral fat. This holistic approach ensures that the fat surrounding your organs is steadily burned, metabolism is supported, and overall health is improved. When starting a focused plan to reduce visceral fat, it is important to understand what realistic results look like in the first 2 weeks. Every body responds differently based on factors such as age, metabolism, genetics, and previous activity levels. Some people may notice early changes in how their clothes fit, while others may feel subtle improvements in energy levels and digestion before seeing any visible changes in their waistline. Combining high-intensity exercise with strength training, nutritious eating, and consistent healthy habits creates an environment where the body can begin to release stored fat, even from deep within the abdomen. In just 2 weeks, many people experience a decrease in bloating and water retention. Reducing processed foods, excess sugar, and refined carbohydrates can help the body shed excess water weight, making the stomach feel firmer. Strength training and cardiovascular exercise contribute to improved muscle tone, which can also create a subtle appearance of a tighter midsection. While these changes may not always be dramatic, they are often enough to provide a noticeable sense of progress and motivation to continue the journey. Some individuals may also notice a slight reduction in waist circumference, an early sign that visceral fat is beginning to respond to consistent lifestyle changes. It is important to remember that this process does not involve a quick fix or instant transformation. 2 weeks is too short to expect extreme fat loss, but it is sufficient to kickstart meaningful habits that can support long-term health. By focusing on consistency in diet, movement, and lifestyle choices, the body is encouraged to gradually burn stored fat while building sustainable energy levels and metabolic efficiency. These early changes, though subtle, lay the foundation for continued improvement. The emphasis during this period is not on perfection or rapid results, but on creating routines that strengthen the body, support fat reduction over time, and promote overall well-being. Reducing visceral fat goes far beyond achieving a slimmer appearance or fitting into smaller clothes. This type of fat, the one that wraps around your vital organs, directly affects your long-term health. Carrying excess visceral fat increases the risk of heart disease, type 2 diabetes, high blood pressure, and other metabolic problems. It can quietly influence hormone levels, increase inflammation in the body, and even affect how your liver and pancreas function. Addressing this hidden fat is not just about looking better in the mirror, it is about protecting your body from serious health complications and improving how you feel every single day. Less visceral fat means more energy, better endurance, improved mood, and a stronger foundation for overall wellness. The good news is that tackling visceral fat does not require extreme diets, expensive supplements, or grueling workout routines that leave you exhausted and demotivated. Simple, consistent lifestyle changes can make a significant difference. Committing to regular movement, choosing whole, nutrient-dense foods, getting adequate sleep, and managing stress are all achievable actions that anyone can take, regardless of age, fitness level, or prior experience. These changes are not temporary fixes. They establish patterns that gradually shift the body toward better fat metabolism, improved muscle tone, and more stable energy levels. Even small adjustments, when practiced consistently, can set off a chain reaction of positive results. Approaching this journey with the right mindset is equally important. Think of it as giving your body a reset, a chance to start fresh and regain control over your health. The first 2 weeks are not about perfection, rapid results, or intense transformations. They are about building momentum, creating habits that stick, and proving to yourself that meaningful change is possible. Each choice to move, eat smart, or prioritize rest is a step toward a healthier body and a stronger, more confident version of yourself. By focusing on small, manageable changes and celebrating incremental progress, anyone can begin the process of reducing visceral fat and improving overall health, setting the stage for lasting results over time. Now it is time to take action and commit to a full 14 days of focused change. Start with a simple workout routine. Pair it with balanced, healthy meals. Prioritize quality sleep and cut back on sugar. These small but powerful steps will set your body on the path to reducing visceral fat and improving overall health. Track your progress along the way. Measure your waist. Notice how your clothes feel. Pay attention to your energy levels and observe any changes in your mood. These little signs will show you that your efforts are making a real difference. Remember, the first 2 weeks are just the beginning. The true results come from maintaining these habits over the long term. Quick fixes might feel tempting, but lasting change is built on consistency and smart choices every single day. Keep moving, eating wisely, and taking care of your body beyond the 2-week mark to see the most significant benefits. Always check with a doctor or health professional before starting any new diet or exercise routine, especially if you have existing health conditions. Your safety comes first, and small informed adjustments will give you the best results. If this video helped you, make sure to hit the like button to show your support and subscribe to our channel for more simple, science-based tips that improve your health, energy, and overall wellness. Join our community and start your journey to a healthier, stronger body today.